I think people need to know the symptoms. I think parents need to know what to look for. There's going to be a lot of hysteria, possible panic now, and parents need to know what to look for. Individuals need to know what to look for in assessing whether they may or may not have the measles. So measles, we talk about fever, rash, and the 3 C's. Cough is one C, coryza, another C, which just means a lot of mucus and phlegm at the back of the throat, and conjunctivitis, meaning redness, soreness, irritation in the eyes. So fever can go as high as 105 degrees Fahrenheit, which makes anyone, but especially children, very uncomfortable, and it can lead to febrile seizures in children, which are always very scary. And rapidly sequential febrile seizures can lead to permanent brain damage. The rash usually starts imperceptibly in the back of the mouth. There's these very distinct spots called Koplik spots that develop around the tonsils, and then the rash spreads out of the mouth, the face, trunk, and then distally to the rest of the body, upper and lower extremities. Cough. Before vaccines, 500 children in America alone would die annually of the measles, and the primary thing they died from was pneumonia. So beware of a child with a high fever, a suspicious rash starting around the mouth, a cough that's productive, coryza, which just means catarrh, phlegm, mucus, so they're very, very snotty and spitting out a lot, and their eyes can be very red. The potential dangers of measles, as I said, it's not a benign disease. Apart from possibly dying of pneumonia, you can also die of encephalitis, which it goes to your brain, and it can kill you within the course of length of that one acute illness, or 7, 10, 12 years down the road, you can get a subacute sclerosing panencephalitis, which makes you miserable. It's hard to discern what you have because the symptoms are so insidious, but it's a slow brain infection that just eats at your brain and you die of that. That is very rare, but it is a known complication.